Hello. Okay. Hi, Sue.
Hi, Malia.
I can't tell who else is on here. Oh, Amy, you're here?
Where's my?
Yep. Hi, guys.
Hi, Amy. Oh. Sorry, I'm disorganized today. Well, my desk is disorganized.
Where's Malia? Where's the camera?
The camera? Well, now I can't see you. I could see you
Here we
before.
go. Oh, yeah. No, really? I couldn't see anybody. Hi, Amy. Hi, Malia.
Well, I'm on here and Amy's on here. So you should be able to see both of us.
Okay, I'm going to turn my camera on. Well,
I don't know if WRSD online is that Maria. I'm not sure.
I don't know.
I'm not sure who has ownership of.
Oh, it's
my friendly
Barry.
streamer. Hi there. Thank you.
You're having people over tonight?
It's okay.
Here
We're
we go.
not starting yet. It's all good. Okay. Yeah, I can see you, Sue.
hi.
But can you hear us? Because you're looking like you're kind of on the verge of freezing.
Poor reception where I am.
Yeah. So sometimes it's easier if you, well, I'm not encouraging this, but sometimes it's easier if you turn the video off. Sometimes you'll get better reception, but I'm hopeful you'll be able to stay on with us, but
So, Amy, yes.
But if the reception is bad,
Really?
then I would start by trying to turn off the video.
My microphone's on. Can you hear me?
Yeah. I can. Oh. All right. Sorry, I have to get my my screens all situated. A second. I have to put the video in one screen and the spreadsheet and other things in the other one. So
Linda's here.
All right. So I'm here. Sue's here and Linda's here. So we have quorum. I think Jana's stuck on an airplane and Asuma said she might join us after 8, but
look, I just
the last time she said that she didn't, so we'll see.
I'm going.
Can you guys hear me?
I didn't touch it.
Okay, great. I can hear you too.
Was that you, Sue, saying you're going in and out? Okay. Can everybody hear me? We're good. We're good. Sue, can you hear me? You're good. Okay. You are going in and out a little bit, Sue. So if you do start to freeze, if you can't hear us, I would start by shutting off the video, and then
hey, Linda.
If you still can't hear us, then we'll figure it out from there. So just letting you know. Okay. We do have quorum, so I'm going to go ahead and start the meeting at 7:01. First, I need someone actually willing to take minutes this evening.
I can do them again.
Thank you, Linda.
Okay.
All right. Let me know when you're ready.
Yep.
Okay. I believe we have to.
Okay, great.
Do we have to record this?
Yeah.
I think
Hi, Linda.
I think we do for the YouTuber.
Yes.
Oh, okay. Thank you. That's what I needed to know. Thank you so much. It's been a while since I've done it all remote. So thank you. All right. The first item on the agenda is the approval of December 20th minutes.
Yes.
I will entertain a motion.
So moved.
Sue, was that a motion or a second, or was that, I heard Linda? Can you hear us, Sue? Uh-oh. Oh,
Okay.
there we go. Can you hear us now?
Oh, I did, I guess. Second,
Okay,
I did
thank
second
you.
it. And I did want to thank Lynn for
Yes,
doing an
I
excellent
can
job
hear
for the
you.
minute.
That's better. Yes. Yes, they're good. All right, so we have a second. All in favor?
Valentine,
Woodland,
aye.
yes.
Yes, thank you. That's right. I have to do it that way. I'm sorry. I forgot that. Thank you, because we're remote. So I heard Linda, yes. Sue, yes.
Yes.
And I vote yes. So they are approved. Thank you. Thank you, Linda. That was a tough meeting to keep track of, so appreciate it. So I'm going to actually, we'll do this next. Item number 3 is discussion of the bullying prevention policy, which was brought to the full school committee at our last meeting. An amended version did get approved by the full committee. The version, I have to talk to Randy because the version that we got from Randy in our packet had one word that I don't think was actually struck. And so I don't know if this is just my recollection. So I wanted to touch base with you all to see if there were any other thoughts going forward or if we're okay with what the committee passed. But before I get to that, the version that Randy sent out had crossed out physical, developmental, or sensory disability. And what I had in my notes was just the physical, developmental, or sensory was crossed out, but not the word disability. So I wanted to check and see if that is others' recollection or perhaps I'm incorrect. And then I wanted to make sure there weren't any other questions.
I agree with you. I'm pretty sure that the intent was to only strike the adjectives with disability, but not the word disability. That was my understanding of the motion.
Okay. Great.
And
I think, go ahead, Sue.
I missed the meeting, but I did listen to the meeting and yes, I concur.
And I think Janet emailed me that as well. So, so I think we're all in agreement. So I will reach out to Randy about that change in the notation. And were there any other thoughts or discussion based on what occurred at the school committee meeting related to this policy?
I did have one question, Malia.
Sure.
And I know we talked about it and you explained it very well at the meeting, as did Linda, in terms of the policy and the changes that were made. But when it was talking about the procedure, I just was kind of left wondering, we're supposed to develop policy, but not necessarily procedure, but we do have a lot of schools and we have recognized an inconsistency sometimes within the different schools. And I'm just wondering who would be developing the procedure, and would that be done at a school level, by
Yes.
school, or would that be done?
So with this version, yes, it's somewhat complicated because there are some policies that have to have some bits of procedure according to law, and there's some where we think it's essential to keep some of it there. But with this particular policy, I believe when we were discussing it, we understood that a lot of the procedure is included in other places. It's included in, let me back up. The short answer is that it's up to the administration to take their policies and turn them into procedures. But the longer version on this particular question is that when we were discussing it, I believe a lot of the procedure is included in other policies and in the bullying intervention plan that we now have that didn't exist when this policy was first created, and has been revised recently. So I think we felt like it was covered in other ways. And so it was not necessary to have that level of detail in this policy.
So as a general rule, who would set procedure?
As a general rule, the school committee is in charge of budget and policies. And as a general rule, the administration is supposed to, or is expected to create procedures and yeah, there's a word I'm missing. It'll come back to me later. Procedures based on our policies to meet what we place in our policies. I see Linda's hand.
So from my understanding too, is that a lot of the procedures are made from central office, and then our additional details are added to be school specific by the building leaders, by the principals. And I think over the years, there's been various kind of cultural shifts of how much happens from central office and how much happens at the school building. And so I think that that's something that usually gets worked out with successive strategic plans and visions and goals for the district. So I would expect that to be part of the strategic plan discussion in some form along the lines, whether it comes down to working out budgets or school improvement plans within the Simcoe setting or what. But that's up to the superintendent to decide how much goes in from central office and how much the building principals do. At least that's how it's been in the past, and I
Yes.
wouldn't see why it would change now. I don't know if Maria.
Yeah.
Actually,
That works.
with this bullying prevention procedure in particular, we have a lot of guidance from, as far as law, that what's required to be in our bullying prevention and intervention plan, and the DESE as well. So they provide us a lot of guiding documents on model plans, and as well as all of a checklist basically for all of the legal requirements. And really there's we're striving to ensure that all of the schools are following the plan exactly the same. So we're absolutely working on that. As Malia mentioned, the plan itself has been recently updated. We're supposed to do that biennially, so at least every 2 years. So we just completed that process, and then we'll have training to ensure that the schools are following the plan, the bullying prevention and intervention plan, consistently across schools.
Okay, so my question was more of a general question because we talked about procedures in terms of, some other policies that we're looking at as well. So by the central office, does the central office have a committee that develops procedures for all of the schools, or is it just kind of as needed or as things come up? Or, I'm just used to something that's a little bit more formalized. You do a policy, and then right after you do the policy, then you work on the procedure, and they go hand in hand, one complementing the other.
Well, they are, I can't answer for what goes on in central office, but I can say from a school committee perspective, historically we have the shift we've had in the past couple years is much more in tune with what their expectations are, and much more aligned with making sure that they're taking steps to implement policies across the board. I can say it has not always been done historically the way it should be in our district, but it's moving the right direction. But that is the school committee's job is not to detail implementation. There are some cases where we can make recommendations, or we can, if we feel something is important, we can pass resolutions, we can do a lot of different things, but our job is to convey our goals, priorities, and expectations in policy, and administration's role is to, administration as a whole, not any one person, their role is to implement, guidelines, protocols, et cetera, in most cases.
Okay, well, I I just want to make sure that it's getting done. That's all.
Right. Well, we can ask for sure.
I just would like clarification of that.
Yeah.
Yeah,
And
we can
just to
certainly
speak-
ask.
And just to speak to that just a little more, there's not one, central committee that takes the policies that are passed and then implements procedure. It really is dependent on the professionals in our office, their area of expertise, right? So I helped to support the update of the bullying prevention policy because that's my area of expertise. And so Amy, this is a great example. Amy helped to drive the, procedures for the life-threatening allergy, right? So it's making sure that the professionals in central office and in the district, throughout the district, are collaborating to help to develop the procedures.
Mm-hmm. And we can certainly ask about how things are being done or ask for updates periodically from either superintendent or through the subcommittee if it's related to our work, or through other subcommittees that it might, if it's related to other areas. The school committee is certainly allowed to do that. But we, both pieces are needed to run things successfully. And so
Right. Exactly. Yeah.
we have to trust that they're implementing, and they have to trust that we're doing our due diligence in creating policies. I'm sure that they're not always 100% aligned, that I know there's times school committee members disagree with, how things are implemented sometimes. And I know there's times when administration disagrees with what policies are put in place or how they're put in place. But, in the end, both pieces are necessary to help the district run successfully. And, so we can certainly ask for how things are working and follow up. A lot of that also comes up in the budget discussions often, because we need to make sure we're spending money on things that are supporting our policies and plans and doing the things that are in them. So it does come up in a lot of different ways.
And just one more thing,
Yes.
the district is working to, on more clarity with communication, updating the website, making sure that procedures are listed there so families have a place that they can go. It's easily accessible. So we're working on that component as well, because we want to make sure that when school committee does pass policy, that we are fully transparent and making sure that families have access to the procedural part of that.
I appreciate that. I know you've done a lot of work, so. Okay. Are there any other questions or comments on the bullying policy?
It'll be wonderful to put it to rest at the next meeting.
Yes,
Getting
hopefully.
the second vote.
We've been talking about it for 2 years, so I will be very excited.
Yeah.
So I will reach out to Randy about the language to clarify, and then we will put it bring it up at the next meeting for a second reading. So thank you for that. Okay, the next item, there are 2 items under the health policies, and I'm going to flip them, but I'm going to explain a couple things briefly to those watching us. I know we have some viewers. My original intent was to delve deeply into the life-threatening allergies policy at this meeting. However, given the logistical changes that have impacted this meeting, and the fact that we have one member that was present for those discussions that is stranded somewhere and not able to be here at all, and we have members of the public who probably will have comments during that discussion, or may have comments, which is difficult to do remotely, and we have a shortened time. It just seemed like it would make more sense to have that discussion in February, and that will be our main focus in February for the life-threatening allergies policy. At least that's my plan, unless some emergency comes up. And to go from there, and we can have a more detailed discussion then. If we have time at the end of this meeting, though, I will certainly open up discussion for any thoughts that people might have in the interim, because we were going to think, about what direction we want to go with that. So I will come back to that if we have time at the end of this meeting. The other policy that is on the agenda is another policy that was brought to us at the same time, and it's a little bit shorter. So we wanted to see if we could get that one done quickly. We almost tackled it at our first, I think December meeting, but we ran out of time. So I thought I would still have this meeting and be able to be useful in making progress in some of our other work. And so that's what I'm hoping to do. So I'd like to begin discussing policy 6611, policy related to pupil services, student immunizations. We did receive a draft of some revisions from Amy, which I appreciate. I hope everyone had a chance to look over them. I'm going to give Amy a chance to, I don't know if you have anything you wanted to say about the document you sent, or if you would like us to, just have a discussion and ask questions and be available to answer questions. But if you have anything you would like to say, I will give you that opportunity.
Yeah, sure. So when I, again, have been reviewing health policies and looking at things that haven't been looked at in a while and talking about making sure our expectations are the same in every school, this policy had come up in the sense of each school approached how they're letting students in without immunizations a little bit differently. And I think having a policy that, one, makes sure that we're following the laws, but two, also is allowing people an appropriate amount of time to get caught up or get their immunizations, and allowing the students to come to school, because ultimately that's what we want. We want the kids in school, but I want to have a policy that spells out the expectations for parents and for follow-up, and also for my staff that has to complete this follow-up process. So with the policy itself, we added some additional exemptions that is allowing people extra time to go for those appointments, to follow up, and if there needs to be follow-up schedules because of medical or any other reasons, that is allowing the kids to come to school while we're waiting for those immunizations. Part of this process is if we don't meet immunization requirements of the state, they can come in and do audits. And so if we don't have this proper follow-up, they can say we might not have 95% of immunization compliance, but we know why. So, we have maybe a certain percentage that have a religious exemption, and we have certain ones that are doing a follow-up schedule. So if my nurses know why there is non-compliance, like having this documentation will help them kind of explain why we aren't compliant if we're not at that point in time. So that was the point of this revision. So I know that you guys can read it, and if you have any questions or if you want to go line by line, I'm here to do that.
Sorry, it was muted. I will open it up for questions that people might have for Amy, and then we can look at the changes individually. But does anyone have questions or clarifications they wanted to ask initially? Linda, go ahead.
So I'm curious about how much of our district is affected by catch-up schedules, and like how differently they're handled, or I guess not so much how differently they're handled, but like the ideal way to handle them.
So part of sorry, we have a family at home. So part of the process is we run reports every year. So for kids that are coming for kindergarten and periodically throughout the school year, because there is immunization, a meningococcal that is age based. So what happens is the nurses run reports to see who is non-compliant, and at that point, that's where we see if there's kids that need to have immunizations, right? So some of it is, when they turn 16, they're supposed to have another set. And so the nurses then make those phone calls to say, hey, we're noticing that your child is missing an immunization. Is there a reason why? And do you have a plan scheduled? So it happens a lot in 6th, 7th grade, and then again in 10th and 11th grade. So those are our two places where the catch-up schedules or like schedule dates, because we know people miss appointments and we know that people get sick and we know that there are reasons why they can't have them, but it still makes them non-compliant in the state's eyes. It's just that we're spelling out, like, we'll give you time, you can do me a catch-up schedule, but if in 30 days we don't hear from you, there has to be some, repercussions about why there's not follow-up or follow-through. Did that answer your question? Yep.
Thank you.
Yep. And, we're not telling people that they have to get immunized. We're giving people options of, you can have a religious exemption. You can have the catch-up schedules. You can have immunity. So there are other reasons why you might not be compliant in the state's eyes because you haven't received your immunizations, but there are exemptions out there. And, we're asking for within 30 days, if we don't have any of these exemptions, that's when, we can, per the law, keep your child out of school. We don't want to do that. So we want to work with everybody and make sure that the expectations, again, are the same in each school. The parents understand why we're doing things. And we have a policy that backs up this law that's out there. So
Amy, I just had a couple questions. So I was wondering about things like flu and, when we had the COVID and COVID vaccines, RSV. So are those handled differently from routine immunizations?
Yep. So those are not required. A couple years ago, the state tried to require flu vaccines, and it didn't go over well. So that only lasted for 1 year. But those aren't required vaccinations. Our computer system still connects to the Massachusetts immunization repository, so we can see who has them and who's not, but those aren't those vaccines that we're searching for. It's those required school vaccinations.
And do you anticipate that they're going to try to revisit that, or that no, there's not been much discussion about that within the state? And
no.
Okay.
Yep. COVID was never required. Flu, like I said, was 1 year, and then RSV is not at this time. Now, again, I also, in the beginning of this document, I changed the law because that Massachusetts school immunization requirement can potentially change. And so this policy could stay for, with us and be continue to be updated just by these links that are connecting us to the exact Massachusetts school immunization information, so that parents know what are the requirements are, even if they change. And for example, the meningococcal, that had a few years where they started giving the vaccine and then we had to phase it in for certain age groups because of the age requirements. And I mean that, whereas we had some kids that only needed 1, we had some kids that phased into 2, and that was just because of how the immunization is administered and because of the age when it was started. So that's pretty much out of the woods. We're now to a set schedule with the meningococcal, but say something comes along in a year or two, we don't have to necessarily revisit this policy because we're referencing the Massachusetts website that gives those requirements.
Oh, I see. Okay. I did come across a notation in terms of a federal program, Every Student Success Act. And you're probably familiar with that because it said it makes the McKinney-Vento Act a little more comprehensive, and it refers districts to their homeless education liaison for foster care. And I'm thinking, I wonder if we have such a thing. Do we?
Isn't that Maria?
That is Maria. Yep.
Oh,
So,
that's Maria.
yep.
Oh.
Yeah, and when we were talking about collaboration, Maria and I was one of the first things that her and I discussed was the McKinney-Vento. And if there are students that, don't have health insurance and, don't fall into this, we're not stopping any of these children from coming into school. We're giving families support with where they can go for medical care, where they can go for immunizations, where they can get free physicals. So we're doing all of that, in conjunction with these immunizations and other things. So yes, that is part of this. So again, it helps us be able to give resources to our families too.
Okay. So should we reference that in this policy, or you don't think that's required?
I mean, I think anytime a student comes in, we're looking for these kind of documents anyway. So that's when Maria and I and the schools have conversations about registration process. So anytime a student comes in that we know that they're homeless or there's question of them being homeless or refugees or immigration, that's when Maria gets involved. So I don't necessarily think it needs to be a part of this conversation because it's more of us providing support and not having to do with specifically immunizations.
Okay.
It is noted.
There's also the
It is. I'm sorry. It is noted.
Yeah.
There's an exemption for, not an exemption as in they don't have to have immunizations, but there's a different process for students that are qualified under McKinney-Vento as homeless.
Mm-hmm.
Already in the policy. Thank you.
Oh, okay.
right. That's letter
Maria,
C.
I'm trying to
It's
give you credit for all your work you're doing. and Amy too. So, okay. So thank you for clarifying those issues.
All right.
Can I just add? I was initially a little bit confused about how the catch-up schedule was being envisioned in this context, but now I understand it a lot better, and it seems like a good support system rather than just I don't know, something else. So
yeah, I mean, it's there. So
I feel better about that.
So there's actual follow-up where, a family can say, oh, hey, I missed this appointment, but I have one scheduled in a month from now. So the nurses are really great about putting it on their calendars because let me tell you, they love making sure all of their people are compliant and the reasons why. So they'll follow up. So, and if they don't follow up, it's again, okay, well, if you missed your second appointment, then what are we doing from there? So again, it's again, more for support. I think this is going to help us with supporting our families.
Yeah. Amy, what are you doing actually in terms of reporting to the state, and when does that happen? Is that an annual thing, or what? How does that work exactly?
Yes, usually the end date is the end of January. So we report on kindergarten compliance, 4th grade, 7th grade, and 10th grade. So we're kindergarten, 7th grade, and 10th grade, sorry, the 3. So that I send a report, my nurses send a report to the state, and then the state then reports that on their website, which we can see the immunization rates of the grades of our schools, and actually per school as well. So, I mean, we're over 95% in most schools. So we're doing a great job, but this is going to help my nurses be able to be consistent with follow-ups and everybody being on the same page.
Mm-hmm.
So, sorry. I actually have a question. I'm trying to think of how to phrase this. So the 30 days, I think you said that's the earliest the state will allow you to take action if
well, the state says that the law states that no unimmunized student shall be admitted to school is what it says.
Okay.
As a policy, I would like to support our families and be able to help them. One, give them resources that they need to and time to get it, because I don't want to say, hey, we figured out that your kid, when they turned 16 in one day, is non-compliant. We're not planning to send these kids home.
We're not going to send them home the next day, which is what the state technically allows.
Correct. Yes.
All right.
Yeah.
I wanted to clarify what the state allowed or required or,
Yeah.
So the state does give us some leeway to put something like this in place with 30 days or however many days. And so what I'm hearing you say, what I think I heard you say, is that it's more of a check-in date than anything else. It's not like we're going to look at, follow up with them on the 30th day, and if they haven't done it, say no, you can't come to school tomorrow.
Well, I mean, we can, right? So I feel like if we don't put this expectation on our families in a policy to say, like, we've called you, we've expected you to check in with us. You haven't. These are for those people that, we've sent 3 notes. We've told them that they're non-compliant, and there's no follow-up. There's no exemption. There's no, they don't fall into any of those required exemptions. And so we can say that after a certain point, they are not allowed in school. So that 30 days is more that we haven't heard from you. We've tried to give you resources and you still haven't done anything. We can, per the law, tell them that they can't come into school. Now, I'm hoping that the 30 days is enough time for people to write me a religious exemption, or, make an appointment with their physician, because then they meet those exemption requirements and their child can stay. So say I have a 30-day notice, the 30 days has gone by, but they have an appointment planned 2 weeks. Like, that's okay, because that's a catch-up schedule, right? Like, there is a plan.
Okay.
It's more for those people that, we've done all of these things and offered support and reached out, sent letters, done all of those things, where there needs to be some point where, and honestly too, like the students shouldn't start without showing us documentation of immunizations.
Well, that was my next question, in just understanding how this is handled now. If it sounds like it's kind of all over the place, but if you have a student new to the district, or whether it's kindergarten or any other grade, who hasn't met their immunizations, or just doesn't provide the information, because I know sometimes people don't, or don't want to, because they haven't met them. So how are they allowed to come to school for the first time, or you say no? If they're new, you just say no until you get some communication?
Nope. The kindergartners, my nurses and the secretaries and everybody are really good about getting the proper documentation. They are not letting, and it is out there that they are not letting students start unless they have these required immunizations. Yep. Again, with
or a notice of some sort.
Correct.
Or letter.
Yep. Or an exemption, or one of these 5 exemptions. Yes.
Okay.
And that's the same with newly registered students as well. So it's the kindergarten registration, and then the newly registered ones.
Okay.
And did this happen, a few years ago? We're working towards consistency, right? Because this is part of the school registration. So, am I 100% that this happens every time? Like, from probably 6 months ago? Yes. Like, we are making sure that we're having the proper documentation, because again, it's that consistency and making sure we're all doing the same registration piece and making sure we have the correct documentation for the kids to start.
Okay.
And again, this is just another way that we're making sure kids are going to the doctor's office, right? Like, if they don't have their immunizations, well, why not? Again, it's being able to help support the families.
Yeah. Well, it's hard to get appointments right now. So that's why I was partially why I was curious, because I know how hard it is to get appointments with any doctor at the moment. So I just wanted to make sure that it was, I wanted to be clear on how this is being implemented, like what it means in reality.
Yep.
So.
And people, and just for, clarification too, like the Walgreens that is in Holden, there are other places that you can get vaccinations, not just your primary care physician. So again, those are things that we share with families, because not everybody knows that too. The urgent cares do some vaccinations, and
Is that also information that's on our website?
I have in my link, I have doctor's appointments, like doctor's offices in our area. So those are all part of that document.
Oh, great.
Yep.
Okay. That's beyond this, but I was just making sure we were doing that as well. Okay. So are there other questions? Do I see your hand, Linda?
Well, I don't know if I'm jumping ahead. I had a question about in the document, letter D, but if you want to start at the top, I can hold it until.
I would start at the top, and but if you have a specific,
yeah, we can talk about D while we're at it.
Yeah, go ahead.
Yep.
Okay.
And then we'll go back to the top, but
yep. This is if somebody has a, like, so for example, chicken pox. So if somebody has already had chicken pox, the doctors can write notes and put that in their charts that either they have a natural immunity, which they have a proven case, or they have a lab result that tells us that they have a positive titer of, the disease in their blood. So when that happens, the kids show up in our system as non-compliant because they haven't received a vaccination, but that doesn't mean that they're non-compliant in general. So this is where if the state comes in and says, why do you have only 90% of students that have the varicella vaccine, I can say, well, because we have this percentage that has a positive titer in immunity, so that we have that documentation to back up why we might not be at a 95% compliance rate.
So then it comes back to how the system works for record keeping, just because I was wondering, well, what's the difference between where it would be a documentation from a physician about why a child didn't have an immunization. It doesn't matter why, but if it was in there. But if it makes it a better process for actually carrying it out, then I see why it would be pulled out.
I think we had some experience with this in our family, because we were one that wasn't immune with like 2 doses of MMR, and we had a reaction. So we went through the testing and we were like the 2% that wasn't immune. So we had to have a third one. So that's another example though, because some kids, you can confirm in other ways that someone is immune. So it's a different process versus just having a documentation that they can't have it for some reason. Like in one case, they actually are immune, and in the other case, they may or may not be immune. Correct? Yeah. Okay.
Amy, I just had one other question, and I just wondered, is any of the data that's collected and you report out to the state, is that attached to any kind of state funding at all, or is that just for informational purposes?
It's really informational purposes. It's definitely information. We don't get any grant funding specifically for immunizations.
Okay.
Okay.
So what I think, sorry, did you have another question, Sue?
Nope, all set. Thank you so much. Thanks, Amy.
Okay. What I think I'm going to do, just for the sake of thoroughness, is to start at the beginning with the proposed changes, or if you all had anything else you wanted to suggest, feel free to jump in. But I'm going to start at the top and just go through the policy. I'm going through the one with the proposed changes as our starting point. So I thought that was easier and made the most sense. So I'm going to look at the first paragraph where it says Wachusett Regional School District is required, and it cites the MGL through the citation of mass school immunization information. Actually, that's a whole, yeah. Does anyone have thoughts on that paragraph, or are we good with it?
And just so that link brings you to just the Massachusetts school immunization information, which is not only about school required, it also just jumps to this repository of information about the school immunizations. And
does that have the charts on it too?
If you click on the specific one that says requirements for schools, which is literally the first link on that page, it has all of your requirements. Yeah. And I update on our website to the requirements for the specific school years on the health website.
Okay. I think that's a good addition.
Yep. The second paragraph, I'm going to jump. I'll just jump.
No, go ahead.
I striked it out because it does not have every specific immunization on there, because this was an older, not older, the law hasn't been quite updated with the meningococcal. So I didn't want that expectation of those were the only ones we needed, when another big one is the meningococcal that we're always chasing people. So I struck out that whole piece because it does reference the law in the previous paragraph.
So it's redundant,
Correct.
basically, because the law includes the list and we refer to requirements under the law.
Yeah.
Okay. Does anyone object to that?
No?
Okay. All right. We're going to go to the next section. No immunized student shall be admitted to school unless they can satisfy these requirements. And also crossing out or be allowed to remain in school.
Yep. And the reason why I crossed out or be allowed to remain in school is because we are allowing 30 days. We are allowing other, catch up schedules. So we're giving a little bit of a leeway to get those requirements.
Okay. So we have provided options, so we're not taking them out day one.
Correct.
Okay. Does anyone have questions or comments on that? Okay. Seeing none. Great. Letter A. A medical exemption is allowed if healthcare provider submits documentation to schools that an immunization is medically contraindicated. Such documentation shall be submitted annually at the beginning of each school year to the health office.
I added annually because this is part of the requirements of the law that it should be required annually. Now, this is something that, again, we chase as nurses because, if the doctors have said it one time, the parents are, I think that it just continues, but the law states every year. So again, it's just something that the nurses will reach out to say, please provide the letter. And usually the parents that know do it anyway every year. So just putting it at the expectation.
That should be annually
So-
to the health office. And is that the health office of the school or is it the health office of the central office?
The school would be the easiest. So thank you for that. We can add school to
Do
it.
we need to clarify that or we need to say the school nurse or the central office or what does that?
I think we should clarify to the specific school health office because that's where those records are kept.
Okay, yes. Otherwise you'll be getting a flood of them in
Yep.
central office. So she'll be submitted annually at the beginning of each school year to the school health office.
Yes.
Okay.
I think that the
That-
students. I think that it needs to say the students' schools health office because I think school health office is still a little bit ambiguous.
Student, okay. How about to the health office at the student school
Sure.
or of the student school? Of the school the student is attending? I don't
Yeah.
know. I'm just thinking.
Yeah, any of those.
I'm just throwing things out there. to
I
make
think
we're
the
crystal
fewer
clear.
words, the better. Just
Yeah.
because I think then you say, so are they attending if they haven't been allowed in yet? Or you
Oh,
know what I
that's
mean?
true.
Does it
No,
mean
I was thinking more
registration?
of
Does
kids
it mean?
that are like in programs at another school. It's not their home school, so they don't get confused. But yeah, you're probably correct. So
Students' school health office. I think that works, right?
students, school. Okay. I don't love the sound of that, but I'll come back to it. That's wordsmithing.
Amy, is
I-
annually okay with you, or do you want clarification on that? Or,
No,
She said
Annually, they have to do it annually.
okay,
Yep.
students, school. office.
do you want it at the start of the school year, or,
It says annually at the beginning of each school year.
okay,
And again, the students' records follow them. So the nurses know who has medical exemptions. So we can run reports quickly so we know who is exempt from certain vaccines and why. So this isn't like my nurses are keeping track. So we can reach out.
I'm sorry, I didn't mean to interrupt.
No,
But
go
can
ahead.
I just ask, is it possible to share I'm just watching the document updating, and since we are online, would it be possible to have it shared, and then that way we'll all know where
Yeah.
everybody is?
Yes, I don't know if I'm I don't think I'm the owner of the meeting though, so I don't think I can do it.
And if this is just going to delay things, it's fine. I
Nope.
just thought that might be easier.
Um,
I saw you writing and I know Maria is typing.
Yeah.
So
You want me to
just to
try?
streamline.
Here, can you see that?
Oh, we're getting there. Yes.
Yeah.
It's mine.
Yes.
Yep. Okay.
Thank you.
And Amy, I'll leave it to you so multiple people aren't doing it.
Okay. So you want me to do it? Okay. And I know she questioned the student's health office, so we.
I'll come back to it. I don't like the way it sounds grammatically, but I'll come back to it.
Okay.
Maybe it's fine. It's just me. Okay. That's a minor thing though. So it's fine if that's where we land. Okay, so then we're on to I almost said number B. Letter B. A religious exemption instead of exception
Yep.
is allowed if a parent guardian submits a signed statement to the school stating immunizations are contrary to his or her. Can we change that to their
Yep.
sincere religious beliefs? Such documentation shall be submitted annually at the beginning of each school year to the student's school health office.
So again, you're your wordsmithing. You're back to the same.
I'm sorry, it just doesn't flow for me, but I'll come back to it. That's like not content. It's okay. And it might be fine. Don't worry. I'm just one person. C, students who fall under McKinley-Vento Homeless Assistance Act of 2001. So that's covered. Does anyone have questions about those two? Sorry. Okay. D, sorry, go ahead, Sue.
Oh, sorry. I just had a question about the formatting because under A, then it has this or, and I'm thinking or is BC or whatever. So the formatting maybe could be a little bit different so it's clear. You're going to do this. If you don't do this, then you're going to do this, or this, right? You have
Right, it says or after each one of them, though.
right.
I just didn't read it.
But instead of A, B, C, D, and E, I don't know. It just seems like.
I think or.
I think that if you just in the sentence above the letters, if you put admitted to school unless they can satisfy one of these requirements, I think that would make the or.
Then we get rid of the
stand
or.
out. No, keep the ors, but
Okay.
It's like belts and suspenders. We got it
Yeah.
both ways.
Okay, that makes sense. Does that make sense? Okay.
Yeah, that clarifies it. Thank you.
Okay.
Oh, and
All
just
right, so
one
then
of
we're on to D, which I'm thinking is an addition. The parent guardian provides written documentation from the medical provider that the student is immune as defined by natural immunity or positive titer. Any questions about that? I think we already covered that. Or E, a certified catch-up immunization schedule is submitted to the health office. And then do we need to say student's school health office there as well?
yes, it's time for your
See,
favorite
that's where I
phrase.
think it makes sense to say health office at the student's school. I think it sounds weird without that. That's just my opinion. But that one in particular, I think it okay. That's just my opinion. With the immunization appointment details and signature of the medical provider. Any questions about that? Cannot talk. That one. Okay. I think that one in particular, I think student school health office sounds really strange personally with that one, but
I
okay.
wonder if we can just put something in the top that says no unimmunized student shall be admitted to school unless they can satisfy one of the requirements, which is submitted to the health office instead of putting it in all of these sentences. I mean, would that help?
Oh, that's
Yeah, I think if you
Yeah.
were to put no unimmunized student shall be admitted to the school unless they can provide to their health office one. Yeah, I don't know. I lost it. It was almost
Unless
there.
they
Yeah.
can satisfy one of these requirements, providing
office.
providing documentation to their school health office.
Yep. Okay. We'll just put providing documentation to school health office and we'll wordsmith this. How about that? At some
By
point.
providing documentation to their school health office. Okay, we'll come back to that.
Yeah, we'll come back.
Should it-
But that would
What if
that
you- what
would
if-
shorten the rest because we could take that out of each sentence.
Yep.
So
Do
we
you want-
can take that whole
you want me
phrase
to-
out of each
You want me
one.
to do that? Yeah. Okay.
Yeah. That makes sense. Thank you.
Mm-hmm.
We still have to wordsmith it, but at least, yeah, that's good. Um, okay.
So then I think that that just opens up for C. And this is, I don't know the ins and outs, I just know the general McKinney-Vento Act, but, you know, is that another annual documentation? You know, does that have to be provided to the health office, or is that only central office?
So it's kind of it's hard because it's both. So when a student wants to start or a parent wants to enroll a student, they usually go to the school office first, that specific school, and then from there, central office gets notified about the registration process.
Okay.
So and then sometimes parents go right to central office. So I think I don't think it necessarily needs to be specified because the registration process happens school level and central office when there are questions, if that makes sense.
Okay, so it's not like it would be going against anything if that now falls under the requirement, the documentation that has to go to the school health office, like in the header
Can we-
before the list.
No, because the health documentation, one of the pieces of the information for registration is the health requirements. So they need to check off those boxes in the health offices before they can register them, before they're approved to be registered.
No, I think I know what I'm trying to think of. I think I know what you're saying, Linda, that all of the others are documentation that you must submit clearly to the health office at the school. But the McKinley-Vento is not really, it's more of a classification of a student. And originally it said, unless you meet one of these requirements, and it made sense that way. But when we changed the language in the opening sentence to include documentation, then the classification is different than all the others.
Okay, so this comes out.
So
And we just put documentation to be provided to the school health office. I mean, if we do that, documentation to be provided, right, to the school's health office.
Yes, but I think the question is, do they have to provide documentation of the McKinney-Vento to the school health office, or is that just a separate process? It's a separate process.
It's a separate process.
And
Yep.
so the way we have it worded right now, it sounds like
It sounds like a person has to do an additional step
right, exactly.
when it would still be one, right?
I wonder, it wouldn't look the same, but if we kept the language that we've gone with in that opening paragraph, no, see, it wouldn't look the same. We could say, no student shall be admitted to school. No unimmunized student shall be admitted to school unless they can. The students who fall under McKinney-Vento Homeless Act should be a separate sentence than A, B, C, D, and E, or A, B, C, D, and E. Yeah. So
I could put it as a note, right? We could add it as another note that says.
yeah, we could say A, B, C, and D and take out C, and then put C as a separate note at the bottom. Or we could put a statement about McKinney-Vento Homeless Act in the paragraph, the opening paragraph there, where it says no unimmunized student shall be admitted to school unless they fall under the McKinney-Vento Homeless Act or satisfy one of these requirements. I don't know if that singles them out though, in a negative way or not, but grammatically that would make sense.
Right.
Can you just repeat what the concern is? Why you think what the confusion is around leaving it as a C?
Because if we change the language in the introductory heading paragraph there, where it says documentation can be provided to the school health office, and then you keep it the way it's written, it implies that the documentation of them falling under the McKinney-Vento Homeless Act needs to be provided to the school health office.
Well, not
I don't get that.
necessarily. Yeah, I think if you say no unimmunized student shall be required unless they meet one of the requirements. So one of the requirements would be that they fall under McKinney-Vento.
Okay.
Yeah, I think that this works, and then the
Okay.
documentation to be provided. So because some of these students do have some records, right? So that
Okay.
put under there, and then it's really just for a registration process, and the nurses note that there's no immunizations or there's catch-ups or whatever the situation is. So I think this still works.
Okay. Do we need to make the sentence where it says documentation to be provided to school health office is a hanging sentence? Do we need to clarify
Is it-
that? Like say
Like parents
any
or
documentation
slash
required
guardian.
should be provided to the school health office or something like that?
Hold on, you both were talking.
sorry.
Okay.
I was suggesting to put in parent slash guardian to provide documentation to the school health office. Or like relevant documentation. I don't know.
Required documentation?
Required. Yeah, required documentation.
Or should provide or shall provide. Oh wait, we hate that word shall.
Well, I mean, I think it is a shall situation though. If
Yeah.
they don't provide the documentation, then it starts that 30-day and then the check-ins and the so on. So it is a
Right.
shall. I think it's like a
Yeah.
nice clean version of the shall for once.
There, now we have a real sentence, so that's good. Okay, that was a lot of work. 15 work. It's all good. Okay. Is everyone okay with that section the way it is now?
Yes.
Okay, because I can't see Sue. All right. Do note, all right, I cannot talk anymore. Unimmunized students, including those with medical religious exemptions who fall under McKinney-Vento and catch-up scheduled, are otherwise exempt from the immunization law. Or, okay. I am very confused.
Yeah, so this
Unimmunized students, including those with medical religious exemptions, those who fall under McKinney-Vento and catch-up scheduled, who are otherwise exempt from the immunization law, may be subject to exclusion from school if there is exposure to certain communicable childhood diseases. Okay, I get that now that I read it slowly.
Yep. So the only thing I added to that was just that catch-up schedule because we added it as an exemption. And this is
Basically means that if you know they are exempt, if you know that they are not immune, they can be removed temporarily if there is an outbreak of something, which is relevant right now as there's measles spreading and goodness knows what else, but in some parts of the country. So,
correct.
or chicken pox or whatever it is. Okay.
Yep.
Got it. Does anyone have any problem with that?
And that's always a discussion with Board of Health. That's in the towns. That's always, conversations that we have with other people before we make any of those kind of decisions.
I think that we have a policy that connects to that, just as a side note. I can't recall the name of it right now. I just remember,
It's
by
the
the title.
communicable disease. Yep.
yeah, thank you.
It's yeah, we covered that during COVID if I recall. There's like
Mhm.
yeah.
We did, but it's like a very different tenor than what would be assumed during COVID.
Right,
I
but
think a very
yes,
different
but
kind
it
of policy
exists.
than what
That's
we
I
thought
meant.
it was
The
going to
policy
be.
exists. I do recall that. Okay. This is
Okay.
good. We're making good progress. Okay.
This is
Do note philosophical exemptions are not allowed in Massachusetts, even if signed by a physician. I know they changed that a couple years ago. So
yes, they did. And I don't, that second sentence, the documentation regarding the above qualified exemptions will be kept in the students' files at school. I didn't know if that sentence was referring to the philosophical exemption that isn't allowed or the rest of the documentation that we just discussed. So I didn't know where that came from.
do we? Okay, I'll come back to this. I have a general question, but that makes sense to me. Does anyone have a question or an issue with that deletion there?
I think I don't have an issue with the deletion in terms of, like I assumed that was it. It was like, well, if it's not allowed, then why are you keeping records anyway?
Right.
But in terms of the exemptions that are allowed and the records in general, and this might be more outside of this policy, so feel free to just cut it off. But in terms of technicality, like, are the students' records at
Kept.
school physically? Is it on the server in central office? Is it, you know what I mean? And so, like, do we
Where
need to
are the records?
worry
kept?
about that?
In the school health offices. The specific
Okay.
students are kept in the school health offices. So, I mean, we could just do another do note. I mean, we could add do note.
No, I wasn't. It was more of
A question. Yep.
yeah, it's more of like that in the, and I should know the answer anyway because of how much I know is paper based in this district still. That of course it would be physical paper that's in the physical
Well, I
office
wondered
and
if
not
it was
on like
something
Power
kept-
School.
Yes, I mean, we do
Power
keep
School.
electronic records too, but the hard copies of physicals and immunization records are currently on paper in manila envelopes, in manila files in the health offices.
Okay.
And there are certain requirements for privacy and locking and all that stuff too that are
Right.
Yeah, that's why I didn't assume they were in the Power School, because there's a lot of health information is totally different set of rules.
Yes.
But it is complicated. I used to work in healthcare, so it's a complicated mess. Okay. Then we have the final do note. If a student is found to be unimmunized during the school year, that parent or guardian, should we say their parent or guardian,
Yep.
will have 30 days after first communication from the school to present immunization records, documented exemption, or obtain, there's an extra space there.
Yep.
Sorry, or obtain the missing immunizations. After 30 days, the student will be excluded from school until noncompliance is resolved.
So again, this is that 30-day piece of, if we haven't heard from them, if they haven't followed through, if there's no follow-up or anything, this is where we potentially could exclude students from school because of the noncompliance. Again, we're giving them options of exemptions, making appointments, doing all of those things. So this is that like last resort. We've tried everything.
Okay.
And we have a letter that's drafted that we did it with the principals last year, that the principals all were shared and used the same. So it gives those time frames and it gives those specific 30 days. And so it's
So
fairly
every school, does it come from the principals or from the nurse?
both. So both the principals. I will tell you that it kind of depends on the school in terms of if the nurses are sending the letters or the principals, but we're pushing for the principals to send it just because that's, the gatekeeper of the school. So some schools, both parties sign it. So
Is that, I mean, this is beyond us, but is that something that we could streamline to perhaps
Yes.
have both sign it? Because that
Yeah.
seems like it makes sense.
yes, it does.
I'm just curious.
Sense.
It seems like that should be that at least should be common throughout each school. Like it's a letter that says the same thing from the same positions at each school. So that's just a side note.
Yep.
Sorry. I appreciate that you have a letter though that's streamlined for everyone to use.
Amy, do you want to
So-
put anything in the policy about the notification from,
Oh, sorry, that's my child.
that's okay.
It's okay. Go, Mom.
Do you need to go?
Nope, she's
No.
just roaring. I don't know what she's doing.
Oh.
She's excited about immunizations, you know.
Oh goodness. I'm sorry. Go ahead about
I'm
putting
kidding.
something.
It's all good.
Would you like to include anything about the notification process or no?
I mean, I think this gives them the letter because when this says student is found to be unimmunized, now what that means is again, like those reports, those nurses don't run a report every day. So, you know, the student could be non-compliant for a month based on their age or anything like that. So it's more just like once, because it could be, it's just the reporting aspect of it and trying to run them at appropriate times, which they're good at. But I don't necessarily think there needs to be in. We're giving them a notification here that says after you're notified. I guess we could word that to say if a student is found to be unimmunized, we could say after the notification letter. I think that makes
I
sense.
think that this is fine the way it is personally, and I wouldn't want to introduce any. I think going further
Yes.
than this is bringing procedure in.
Yeah,
Yeah.
I actually was going to
This-
say the same thing, Linda.
Yeah, I think that
Um,
makes sense.
I do have a style question just in terms of lumping subjects together. Would it make
Yeah.
sense to put the philosophical note right at the end of the list? So that way it's with all the other exemptions but this doesn't count. And then the 2 paragraphs that explain the reasons for exclusion are together as well.
Yep.
Yes,
That.
it would.
Um,
So
and
we're
then
going to move the second due note to the end of to the first, basically.
Yep.
right.
There it goes.
And then just as a question across our policies, I would suggest that we just have those paragraphs rather than the do note. 'Cause
Yeah.
I think that our other policies don't, I think that the original of this policy has those, but
Right.
the rest of our policy book doesn't,
Right.
doesn't highlight things in that way. So may as well be consistent across our book.
Yeah. I was
Um,
trying to think of how to phrase that because I didn't really like the do note because we don't really use that. It's just part of the policy. It's not like an addendum to the policy. It's just part of the policy.
And then I think that the only other possibility would be, I know we've talked about when do we refer to our policies within the reference list? If we, would we want to put in any of our current policies in that list, like the communicable diseases? I don't know if I haven't read the health and wellness recently, but I didn't know if there was something about immunizations there or something. Maybe there isn't.
I don't think there's
Probably
anything.
not, right? No,
Yeah,
because
no,
it's
I
about
don't think there's
education. Yeah.
Just the communicable diseases then.
Let me see what number that is.
I had them up earlier today, but I don't have it right now.
Okay. Let me.
And along the lines of consistency, I just where you had the laws
Yep.
in the other policy, it did specify legal references, and then I'll also copy that, and then it says cross-reference for the policy.
Okay.
So I'll
I'll-
copy it in so that you have that there already.
Okay.
Mhm.
I'll add that.
Okay.
I am just searching for the communicable disease one at the moment.
It's oh, I don't have it up anymore.
It's not pupil services.
No.
Which is-
It's It is. I think it. No, I think it is under pupil services. Hold on. It's under. All right, no, it's not. I thought it was.
Yeah, it's not. Hold on. I think I have it linked on my website too.
Some of our policies are in weird sections, so. Hmm. It's weird. I don't see it. I don't see it
Alright,
anywhere,
well,
which is weird. I know it was in here. It did exist. Maybe we got rid of it. That's possible. We got rid of a lot of things during COVID.
Yeah, but I remember we were talking about this in management just last year. And then
Yeah.
it wasn't what we thought it was going to be.
I don't see it though.
I know.
I'm
Well-
staring at them too, and I do not see it. But
Oh, wait a minute. Employee communicable disease and serious illness. Like that's about communicable diseases.
so we have
that
an employee
number- Yeah, that's an employee one, but P5241.
one. And that wouldn't apply to this because this policy is about students.
Right.
Reportable
Maybe we were
disease-
looking at an MASC. Oh, sorry.
Nope.
Maybe
nope,
we
I lied.
were.
Yeah, I don't see.
Well, I have their policy manual up. They do have one about immunizations, but I don't know if they have one about communicable diseases specifically. They have a lot that we don't. It's students. Let's see.
Here's a policy relating to pupil services health, and it's one sentence.
Oh, what does it
Says
say?
will provide reasonable health service for students with according to the state laws. That is
Yeah.
what the health policy is.
Okay.
Hmm.
Oh, MASC does have one on communicable diseases. That's probably exactly what we were referring to. We do not, but they do.
Yeah, so there's not a cross reference.
No,
After
unless you
all.
want to cross-reference MASC, but this is a totally different one. That the focus of that policy is
It's about what happens, right? It's
that we
like
must
the
provide
second to
them
last paragraph.
education, et cetera, et cetera. Basically. But it also says probably something we should have, but I don't really want to delve into it right now. But it seems like something that related to this we should probably have, but that's
What is it based on what you do when they're out? Is that what that one is?
yeah, it basically says the district is required to provide education services to all children right within its boundaries, but admission to school may be denied to any child diagnosed as having a disease where attendance could be harmful to the welfare of other students and staff. But it talks about communicable diseases which may affect students from common childhood diseases, acute and short-term in nature, to chronic life-threatening diseases, and it talks about how they shall be managed with the Department of Health guidelines, but also that we have the district reserves the right to require a physician statement to authorize their return to school. Talks about educational placements. It talks about if they provide for if they are required. if they qualify for services as a disabled child under the law, and also that neither this policy or placement of a student shall preclude administration from taking any temporary action, including removal of student from classrooms deemed necessary to protect health, safety, and welfare of student, staff, and others. So it's related. Yeah, it's how you handle situations if there is someone and that you have a right, you're required to educate, but you also have a right to remove them from school. So probably worth looking at in the future, but
Yep.
I don't know if I'll put it on the list for the future, but not at the moment.
Yeah, so we have the one for employees, but we don't have one for students.
Yeah. So, I mean, yeah.
And just as far as cross references in the bullying prevention policy, we cross reference the bullying prevention plan at the bottom.
Okay.
So do we
Great.
have a formal plan, Amy, for immunization process yet?
Not written out, no. Well, I mean, the letter really is just kind of in general what the plan was. So, but we can create it.
Okay. Okay. Are there any other changes or yeah. Any other comments, questions, or changes in this?
So should we just get rid of where it says cross reference? Because we just added that a second ago, but now we really
Yes.
don't have anything. to
Don't
cross-reference.
have any?
So we should leave it.
Yep.
Until we review the communicable disease policy for students and employees.
I don't know if we're going to get to that this year, but I did make a note that we don't have one
Yeah.
and it should be looked at related to this. We could do it or EdSub could do it probably too, but that's a whole other discussion. So, can we go back up to above the A, B, C, and D just to reread through it? Thank you.
Do you need me to make it bigger?
Okay. Can everyone read it?
I can make it a little bit bigger.
Oh,
I just
that's
made
too
mine
big,
bigger.
though.
Hold on, but then I don't know if you can't read that whole thing, right?
No, I think 100. That's fine. Now we can.
There we go.
Does the sentence that says shall provide required documentation to the school health office, is that clear for everyone? And do we think it will be clear enough to our families? Okay. Because it implies at the school. Okay, just checking. So we're just going to read through it one more time and make sure there aren't any
Do you want me to go
other
down?
comments. Yep.
Advanced? Okay.
Okay. Does anyone have any questions or comments remaining? And if not, I would entertain a motion to recommend this to the full committee.
So
Second it.
moved.
Well, I'm not motioning. I'm entertaining a motion.
I so
you
moved to your
haven't done it yet.
Okay, so we do have a motion to recommend this to the full committee, obviously with the standard caveat that pending legal review, correct? The lawyers will need to double check that it's okay, but okay. we need to vote on that. Let me find my spreadsheet.
Can I just double check the wording here for the motion?
Yes.
To recommend to the full committee policy, to amend policy 6611.
Yes. Say 2611. Okay. Oh, 6611. Sorry. It's not 26. P6611. Okay. So we have a motion and a second. Sue?
Yes.
Yes. Linda?
Woodland, yes.
Valentine, yes.
I'm sorry.
Yes.
And I vote yes too, but somehow I just screwed up my spreadsheet. So just a second. Hold on.
Am I in trouble for not keeping up to the spreadsheets since
No,
everything's
I've
been
been doing the
unanimous?
spreadsheet. I just screwed up. For some reason, it's not recording the yeses, so I am going to just, I'm just gonna send a note. I don't know what's going on with the spreadsheet. So, okay. So we have sent it, motion to recommend full school committee approval. Of,
Pending legal review, right?
we don't need to have that in our motion, but I assume that, yes. Maria, are you able to send it off to our attorney to make sure that he doesn't have any concerns?
Absolutely.
Thank you. That's just what we do as part of our process once we have a standard policy ready to go. Hopefully it's a formality and there are not any concerns. Okay. Great. So that's done. Thank you. Oh, now it's showing. Okay, I give up. All right. So that's done. The next item on the agenda is, say I go a couple different directions. It is the life-threatening allergies. As I said, I didn't feel, and I was correct, I did not feel that we'd have time to have the thorough discussion this evening. Also, it's difficult to do remotely. But I will ask if there's any, I guess, thoughts or general direction that anyone wishes to share regarding that now that we've had a little while to think about it, or if you just want to save them all for the 6th.
I would prefer to save them personally
Okay.
and just make sure it's whole cloth
Okay.
while we're fresh and have everything together.
Okay. I guess in terms of process, if there's anything that anyone had thoughts on, or we're just ready to dive in, hopefully.
The one thing I wanted to just bring up is that I cannot make any Tuesdays for the rest of the school year.
Okay.
So I will not be able to attend the 6th.
Okay.
So as much as
All right.
I want to be part of that,
Yeah.
I also know I don't think it would be fair to have the
Times.
discussion right now. And if I have to miss the discussion on the 6th, so be it. But if it is possible to change the date, I would very much appreciate it.
Okay. I will look. I'm not sure we came up with that because, as you know, there's a lot of moving pieces in February with budget things, but I can talk with Maria and see if there are any other options on the calendar around that time. We can talk.
But I know it is tight, so if it has to be that way, it has to be that way.
Okay. No, I know you had a big change in schedule, so that's why you changed all of your meetings. So it's all good. Because I'd like to have the whole committee here if we can, obviously. As I said, we have one member missing tonight due to travel unexpected travel situations, and we have one member who, you know, sometimes comes but has a difficult work schedule. So we will try certainly to make sure that everyone can attend, or as many as possible. So I will talk with Maria tomorrow about that. Okay, so then the next item on the agenda is new business. Are there any other items people would like to recommend or bring up in the future? Put on the agenda for the future. I have one. I know I can make my own, but I will. I really would like, and I was hoping we would get to this before the budget season, but we have not. I really would like us to discuss with administration and amongst ourselves the value of an equity audit of some sort, or at least pieces of one, because it is something that we have not done, and it keeps coming up year after year. And even if we cannot do a full one, perhaps there are some steps we can take to start collecting some of that data going forward. I would like us to at least have a discussion as a subcommittee if it's something we would like to, that we would be in favor of or not in favor of, because obviously it's not just up to me. But I think we've been talking about it in various ways for a number of years, and I think the subcommittee at least needs to have a discussion about kind of what we feel about it. Okay. Is there anything anyone else has for future agendas? Okay. Upcoming meetings, we have February 6th. I will talk to Maria about if we can reschedule it. I'll try to do that quickly. Is there anything else before we adjourn? No?
Just thank you for all of the suggestions and explanations and making yourself available for
Yes.
helping us understand.
Yeah.
Yes.
Thank you guys.
Yeah,
I think
this one we,
it's
you know, I
really
think makes sense, and I think
critical
it's
that-
something that is. Go ahead, Sue. Sue? Did we lose Sue? She's still there. I can't hear you though, Sue. I hear beautiful clock chimes from someone.
That's,
Okay. All
they
right.
drive me crazy every 15 minutes.
Oh, well, they're beautiful. So I can't hear you, Sue. I feel bad. If you have something urgent, you could type it in the chat and I can read it out. But it looks like I'm not sure if you're even here still. I mean, you're here, but
And she's
can you
muted.
hear us?
Oh.
Can you hear us, Sue? She's
How's,
not muted.
am I back?
Yes, you're back. Okay, so what were you saying?
Yeah. Yes. Can you hear me?
Yes, go ahead.
Can you hear me now?
Did you have something to say before we wrap up, Sue?
Oh, okay.
Yes. Just talk.
I have kind of a crazy schedule too, but I really think that's important to have Linda available for the
Okay.
Tuesday.
I did make a note.
I-
I did make a note, and we'll see what we can
Should I
we can do.
start from the
So-
beginning?
No,
I heard you
I
say
think
that
we heard you, Sue. It's just choppy.
Kind
That
of a
your
crazy
voice
schedule,
comes in
but
and
I think
out.
it's really
I
important
think it's important to have Linda available.
that we try to.
Do you want to type it into the chat and then I can read it?
Linda.
There's a text box.
Never
Yes.
mind.
I got the general gist, I think. No, I
Okay.
think we got the general gist that you are hopeful that Linda can join us for that discussion. So it's good. Okay. I will entertain a motion to
Okay.
adjourn unless someone has anything else to add. I don't know if our administrators have anything else to add or
Okay.
I would thank you all for your time. I know you've had really
Okay.
long days. I know Maria's been there all day
I'd like to
with events for parents in the middle of the evening.
see if we can accommodate Linda. I think it's really important that she be available
Yes.
for the February meeting.
Yes. I'm going to work on it.
So
So thank you.
however we need to do that.
So I'll make a motion to
Mm.
adjourn.
Yes.
Can you hear that?
Do we have a second? Yes. Did you
Okay.
second? Yes. You know what? I'm going to make it easy. I am going to declare the meeting adjourned because I can do that, right? We've learned from Scott that the chair can, if we've accomplished all of our business, can declare the meeting adjourned because we've accomplished all our business. So I will declare meeting adjourned at 8:33.
All right, thank you.
Then we don't
everyone.
have
Good
to
night.
vote technically and worry about the technology.
We lost
Right?
quorum anyway, so it's we're adjourned, right?
Yeah, we're adjourned. Okay, that was interesting.